Hello Paula, nice to see you.
Hi there.
So we've got our supervision session today. What I'd like to do is just set the agenda as we would normally do. So I'll do a check-in with mood in a moment and see how things have been for you clinically. We'll do a bit of a recap from last time. What have you got to bring to the agenda today?
Just some advice really on a patient that I've been working with recently.
Great.
Really helpful.
Wonderful. Okay, so we've got one patient, and then as we would usually do at the end, we'll check in to see if there's anything else, but then we'll do a recap and plan around what we've discussed today, if that's okay.
Great.
Yeah, brilliant. Okay, so how have things been for you? Let's go with the mood check. How are you, and how have things been at work?
Yeah, no, it's been good. I've been sort of back to doing a lot of stuff out of work now, so I've been doing lots more training yeah, it's given me a lot more energy, which is great because I think I was lacking energy for quite a while. But yeah, now I'm back doing stuff again. It feels great.
And that's interesting, isn't it? And what are you noticing that doing more out of work, how does that help you in work or not?
It does, because I don't know, I think I've got, I guess having more of a lust for life or whatever gives me that passion back to actually work with and help people.
Yeah, absolutely. So noticing that it's important to have that home sort of life and busyness, but that actually has a really positive knock-on effect at work.
Definitely.
Good. And how has it been at work for you? What's the month been like?
Yeah, it's been good. It's been busy. We've got a few new people on the books, so that's always an advantage when there's new people to go and see and assess. But yeah, it's felt really good this month actually.
Good. So some newness, some different people to treat. Great. Okay. Anything else that I need to be aware of around how you've been or what you've got coming up?
No, just to remind you, I'm on leave in a couple of weeks' time, just for a long weekend.
Wonderful. Okay. Well, we'll make sure then that we set the next supervision so you've had some time. But yeah, if you're just away for a long weekend, that will be fine. Great. Okay. So thinking back to what we talked about last session, you had quite a complex case that we were discussing, and you were going to put some quite specific plans in place. How have they gone for you?
No, that's all gone really well, and patients responded well as well. So I think that's been another sort of really good point about the last month, that actually to see those changes starting to happen, which is really good. So yeah, thanks for that. No,
I'm really pleased for you, and that's down to the work that you will have put in, because I know that it had been really tough for you prior to that. So well done. I'm really pleased for you that that's gone well. Any learning you can take from that, do you think? Anything you can take forward in your practice?
I think there's quite a bit that can be taken forward, to be honest. And I think one of the main things is like, always remember you can take that step back, take a step back away from it, look at the big picture, and then look at sort of problem solving in a stepwise fashion rather than sort of trying to tackle everything head on. So yeah, it was really helpful. Thanks for that. No, I'm really pleased for you, and like I say, we worked together to try and come up, but it was a difficult plan, wasn't it? But you actually had to put it into practice. So I'm really pleased to hear that, and thank you for feeding back, because it does make a difference that we know that then that what we discuss here can be useful on the ground, as you like. Good. Yeah. Well done. Well done. Okay, let's have a think then about today's question. If you just want to give me an overview of the patient you're going to talk about, and then let's think about what the question is that you have around them. Yeah, okay. This is a 40-year-old lady who I've worked with before. She has bipolar disorder, and she was diagnosed with type 2 diabetes around 4 years ago, and she's in the last sort of 3 months, she's reported she's had a couple of hypoglycemic episodes, and this is something quite new to her, and it's quite worrying for her, and it kind of gets in the way of what I think might be beneficial for her, because if she's going to start doing physical activity again, then we need to be sure that she's not going to end up having a hypoglycemic episode because of having done the exercise. I've noticed that she was taking metformin before, but I've noticed that she's now taking a medication called glycoside, and I know that is part of a family of medicines that can cause hypoglycemia, so it's quite well known for that.
Yeah.
And I don't know if she's kind of twigged that might be one of the reasons, but she is actually saying that since she's had this new medication or whatever, she's been a bit concerned. And I guess my bother is that she might decide that she's going to stop taking the medication, and if she stops taking the medication, then we all know that having hyperglycemia is not good over longer periods because of the damage it can actually do to your cardiovascular system. So I'm kind of keen to get her back on track again, but I kind of don't quite know where to take it, because I don't want to sort of put her off of taking medication that she's been prescribed, but at the same time I don't want to try and encourage her to do something which could cause her some more hypoglycemic events.
Sure. And just a question around, how has her bipolar been through this sort of 3-month period?
She's been okay. She's a little flat at the moment, and I think some of that is because of the type 2 diabetes.
Mm-hmm.
I think she kind of feels that it's owning her a little bit at the moment, and she lives on her own, but her parents are quite close to her, and I think they've been not crowding her, but I think they've been quite concerned about her recently. And also she's got a little dog, and the little dog's not been well. So I think that's a worry for her, because
Yeah, so it sounds like the diabetes and the hyper attacks have come in, but she's also got some other things, maybe with family and her dog.
Yeah.
And she lives on her own?
She does,
yeah. Okay. Okay. So your question is more around the medication, do you think?
Yeah, because if there's... obviously there's a lot of different families of medication out there, and it may be that there's something better that she could be on, maybe something that has, significant cardiovascular protective effect. Because she's not, at the moment, she's not got any symptoms of cardiometabolic syndrome, but other than the diabetes. But I'm just concerned that especially if she's going to sort of start thinking about maybe not taking medication, that we could end up on a downward spiral. So yeah, it's really about that maybe that if there's an alternative, that might be a better option for her.
It sounds like you're already starting to think about the solutions, and obviously your medication knowledge is very good anyway. So I'm wondering where you might think about going to really talk about her particular situation in terms of the medication she's been put on in the last few months. Who and where might you go to have that conversation, do you think?
Well, I think that probably initially the first person for me to speak to might be her GP, if she'll consent for me to do that, and I'm sure she will if she feels that this is something that's going to benefit her.
Okay. Just come back from that second, so the first conversation is with her. How do you feel about that, having to have that conversation about her medication? Have you concerns around that?
No, I think because she's already I think she's already got an idea that this has been since she's been on this new medication, and I think she'll be happy to talk about it and be happy that we're trying to come up with a solution together that is going to work better for her.
Yeah.
So you know, I don't really have any issues in approaching it with her.
Right.
So
Yeah. No, that's good. So the first point might be about that initial conversation. Like you say, she's already mentioned it, so it feels like you can draw on that to have that conversation. So then the GP prescribed the new diabetes medication, I take it?
To be honest, I'm not sure if it was the GP or whether it was the diabetic clinic, but
Okay.
you know, the GP obviously should be able to tell me that.
Sure.
So I just, out of respect or whatever, I would go to him rather than contacting Serene Health and Care or whatever to speak to the diabetic nurse.
Yeah, great, okay. And is there specific questions that you think it would be helpful for you to prepare before you speak to the GP?
I think as long as I'm like quite succinct in terms of like, you know, this is what the patient's reporting, and I'm aware of the fact that glycoside can be a trigger for hypoglycemia. So, and I know her GP. Well, I know of her GP, so I don't think it will be badly received or whatever if I bring it up. I think if anything that'll be, like actually, great, good point or whatever, and thanks for picking it up. So, no, I don't have any issues.
Yeah, and it sounds like that will be really helpful for shared care, because that interaction between the mental and physical health then is really joined up, isn't it? So
definitely.
No, absolutely. So speaking to the GP, talking through different types of medication, seeing if that's a possibility. What do you sort of foresee as the outcome of that conversation? What would likely happen next?
Yeah, well, I'm hoping that so she can come off of that particular medication and maybe try one of the other meds that's out there on the market that should help. But in fact, we know there's good evidence around physical activity and it helping to reduce blood glucose levels. So, it may well be that we can almost get her not into remission by any stretch of the imagination, but if we can reduce her need for medication, then that's a win-win situation, and I'm sure she'd be delighted if she could reduce what she's taking.
And just as you're talking there, and she sounds like she's already got an idea that the medication is having an impact on her, both maybe around the worry around the hypo attacks and her mood. Do you feel that the approach of you going to the GP as opposed to her going to the GP, is that still the way that you would like to think about it as a first option, do you think?
I guess my concern is that if she goes to the GP about it, she doesn't have the best opinion of her GP at times. I think it depends. I think some of it is around not getting what she wants all the time.
Okay.
But I think she would be happier for me to approach it as a kind of a third party and an intermediary.
Yeah.
And I suppose I've got a bit of a concern that if she goes to the GP that she may not be completely honest with what she's actually telling him. So.
Okay. And is that something that you can broach with her as you go through? Because it sounds like you've got a good relationship and you know her quite well. Is that something you think that you can broach with her at some point?
I think so. But it's obviously she's known her GP for some years, and there is a relationship there. But I think it gets put under pressure at times, shall we say? Yeah. So yeah, and I know she'd be happy for me to have that discussion, and I think that she would rather I have it than she has it, although ultimately it would be really nice to be in that position where I can actually sort of hand back the responsibility to her to say, well, why don't you?
Yeah. But it feels at the moment, with this being quite an acute phase, because she's been diagnosed, you said, for 4 years, and these have come on quite recently, so it sounds like something needs to happen sooner rather than later, because like you said, your worry about her not taking the medication or suddenly stopping it is probably worse than if she's continuing and you're having this conversation. So yeah, so I guess it's whether you are able to speak to the GP and say, would you want to broach this with the patient, or do you want us to do that together, or whether she comes in separately. So yeah, no, I think that's, yeah, that feels, but it sounds like you're really engaged with her and you're understanding how she works, and that's the benefit, isn't it, of having the longer term work with the patient.
Yeah,
good.
Yeah, I think we kind of get each other.
And so following potential, you know, re-looking at medication, whatever the outcome of that may be, you're saying about your treatment plan with her is to increase her physical activity. How do you think you might go about that?
Well, I kind of know from experience that being prescriptive isn't going to work for her, so I definitely need to take the approach of being led by what she feels able to do at the moment, and what she actually wants to do. Yeah, I think, you know, when I first met her, it was very much a case of saying, right, you need to do X, Y, Z, X many times a day, blah, blah. But, you know, that didn't work, so, you know, we had to have a different approach. So, I will be asking her for an appointment to actually sit down and discuss where we go in terms of what is she feeling comfortable to do, what she feels comfortable to do at this point in time, and, you know, and look at what the barriers to her being able to achieve that might be, and, you know, look at setting some kind of collaborative goals, and making sure she actually takes some ownership of it as well.
Absolutely, yeah. Because what is the hope of her taking ownership? What will hopefully happen in the longer term?
Well, I mean, it's like ideally she needs to be in that position where she can self-manage her diabetes better. And, you know, it would be so good to think that we could actually potentially put that type 2 diabetes in remission, but, you know, that's something that, you know, we can talk about. You know, I don't think it's completely unrealistic, and, you know, it's a case of sort of actually, you know, maybe using that as a not as a sales pitch, but like, you know, how would you feel if you know, between us we could actually come up with a plan that might help you to get to that position.
Yeah, absolutely. So what I'm hearing is sort of short-term, medium-term, long-term goals might be, you know, with the remission being the longer-term goal, which sounds really positive. Anything else to take in mind, given her diagnosis, and anything around the bipolar? I mean,
you know, yeah, she's going to have times when she's not going to be able to manage, you know, potentially even the simplest of plans. But I think, you know, if we can plan for that, I know it sounds like planning for something which we don't know may happen, but if we can come up with not a relapse plan necessarily, but if we can come up with something, then you know, I think that might be really helpful, because there's been a long period of time where she admits she's been quite sedentary, so you know, we want to kind of reverse that really and try and sort of make a plan to keep things on track moving forwards. But, you know, there's all sorts of things that could get in the way, but, you know, she's the best person to sort of tell me what those things might be, and then, you know, if those things happen, maybe there are ways we can work around things together. Yeah.
So it's a bit of problem solving, so that might be useful in there as well. Yeah. And certainly, you know, her parents and their involvement's helpful, you know, and encouraging that, and hopefully her dog getting a bit better soon as well.
I mean, she seems to have a reasonable support network, so which is always helpful.
Good.
And yeah, I think as long as people don't put too much pressure on.
So how does that help you think about the sort of goal setting with her? What might you need to be aware of?
I think, you know, might be quite good if she's happy to, is perhaps to involve her family as well, because she's got a sister she's quite close to too, so maybe actually getting them a bit more on board with it.
Sure.
Might be, you know, if she's happy to, that might be,
Yeah.
you know, something else that works really well.
And just bearing in mind the pressure, you know, and how much and how little
Yeah.
is good to put on there. Good. Okay, so you came with a question around the medication and where you might go next. What have you understood from what we've talked about, and what would you like to do now?
Okay, well, I think it's fairly clear that, you know, the first thing I need to do is have that, you know, conversation again with her and just say, you know, I've looked at sort of background, and I think that you know, there might be something in what she's already said around medication, and ask if she would be happy for me to have a discussion with her GP around it. And she'll also know as well whether it was the GP or the clinic that actually put her on the meds to start with. So I mean, she might just turn around and say, well, it wasn't the GP, it wasn't the doctor who put me on it, was actually one of the nurses from the clinic. So it may be that she says, actually no, don't have a conversation with the GP, speak to her diabetic specialist nurse around it. So finding out from her really where she wants me to take it, and if indeed she does want me to move it forward, because she might decide actually that she feels that she wants to have that discussion with the GP or with the diabetic nurse. I mean, I guess I'm a little bit, maybe a bit cynical whether she'll actually do that at the moment.
Okay. And where do you think that cynicism comes from in you?
I don't know. I mean, like, I've known this lady for quite a while, and you know, our relationship to start with wasn't the easiest. Although it's got a lot better. It's just like, I don't know. You know, I guess I need to give her the benefit of the doubt to start with, and then take it from there. Yeah.
But it's good that you've got that awareness for you of what that might be about. So maybe then just having that in mind when you're talking to her, and let her lead to see where it might go next. And if you wanted some more specific information around the medication change, just for your, not necessarily about her particularly, but for your information, do you know where you would go to look for that?
Yeah, I mean, I could speak with one of our pharmacists just to find out what their thoughts are on it. Yeah, you know, that's easy enough for me to do. I can pick up the phone and call one of the pharmacists and just say, what's your thinking on this?
Good.
Because at least that way as well, you know, it makes me, if I am going to talk to the GP, it makes me feel a bit more comfortable that I've got it kind of right in my head.
Absolutely.
Not right necessarily, but I'm kind of on the right track.
Absolutely. Yeah, no, that sounds good. Okay, so plan, just in brief, where are you going next?
Back to the service user,
Great, and then we'll see from there. Any other sort of thoughts or questions around her at the moment?
No, I think things are going okay. I mean, I would like to get something, you know, put in a care plan. Because I just think that, you know, actually it's always, for me, it's always better if there's something that, you know, we can both be working towards, rather than just sort of skirting around things and just going to visit and having those same conversations again. I think actually having a plan in place is, you know, it makes me feel a lot more comfortable. And I also feel then that I'm not just, you know, calling in for a cuppa or whatever. It's because sometimes you kind of feel like, what am I actually? But you know, I know that she needs the support and the help. So.
Yeah. And it sounds like you've got that balance, you know, trying to make sure that there's a plan and she's involved in that plan, but also that she has that ongoing support from you. It sounds like your relationship has really developed over time. So yeah, it's good. Good. Okay. Anything else? Any questions?
I can't really think of anything specific at the moment. There was something I was going to maybe mention about another patient, but I'm kind of I'm not sure at the moment, because I've kind of got a plan of what I maybe need to do around that other person.
Okay. What I'll suggest then, just because of time, is that we'll stop today's session as we've planned.
Okay.
But what I want to do is book in the next session, so we'll do that in a moment.
Okay.
And make sure then that you've got the next patient to bring, if that's the person that you want to speak about for next time.
Yeah.
And if you need anything in the meantime, you know where I am.
Yeah, brilliant.
Brilliant. Okay, thank you very much.
Thank you.